May I please ask that all mics be muted at this point? I wish to welcome all members, Minister Mbombo, our Head of Department, Dr. Klute, all officials and members of the public or guests in attendance today. Members, please allow me to first and foremost express our sincere condolences to our procedural officer, Ms. Namonde Jamke, and a family with the passing of a mother. And our wish to them is that God may grant them comfort in this very difficult time. I also wish to thank Mr. Matthews for standing in, and thank you for your assistance today as well. And having said that, thank you to all WCPP officials for your assistance today as well. Members, can I kindly ask you now for the record to indicate your presence as well as any apologies or members standing in for members, please. Kindly proceed. Thank you.
Good morning, Chairperson and officials in the department. Regan Allen.
Good afternoon, Chair. Department, Lorraine Botha.
Any other members? Can we see if members are having difficulty to connect? I saw member Windvogel earlier on. Wasim, can you perhaps guide us?
Chair, I'm just checking in with member Windvogel now to see if she is having any issues. But it does reflect that she's in the meeting. But I'll check with her now.
Thank you so much. Members, in the meantime, can I just alert you to our virtual means of engagement? I would ask you to kindly raise your hand should you want to address the chair. Should you not be able to, kindly make use of the virtual chat box on your right-hand side. Colleagues, we are a bit pressed for time at this point, and I would really rely on members' discipline in terms of us dealing with the business of the day. I have said my welcomes to the Minister and the department. We now, members, in order for this meeting to proceed, and the purpose of this meeting is to discuss Vote 6, Health, in the schedule to the Western Cape Second Adjustment Appropriation Bill for 2020-21 financial year, B7 of 2020, and to consider the committee report on this discussion. I will now allow the Minister as well as the HOD to make some introductory comments. And may I ask the Minister and the HOD to kindly collectively limit this address to 5 minutes. Thank you so much. Please proceed, Minister, and then HOD.
Good afternoon, Chair, members of Parliament, also to the department, HOD. I see there are many of us from the department and also staff from my office. Thank you for having this opportunity, Chair, so that it doesn't come back to me again, because as you indicated, there's a limitation of the time, so that when the HOD takes over, then they continue until we have the questions. So I just also want another minute just to indicate that we came from quite a hard year, starting from when we had our first case then. Where although we had our first case on the 11th of March, but the only time that there was a commitment regarding to the money starting from the national, it was quite late, up to the time that we have already utilized our own monies, and also we have to shift Robin Paul to pay Pauline the non-COVID services to the other. So the 2 billion plus that we ended up receiving, which is about 500 something that came from through the HIV grant, the 1 billion coming from the provincial treasury and also from our own monies, as I indicated earlier. It came at a time that things were quite very bad. Whilst we are talking about these now in terms of the appropriation, the members need to take into consideration that we are not out of the woods yet. And also we'll try as much as we can to see to it that things do happen, because unlike in other sectors where we can just close the door and then prevent people from entering, for us, we still have to render these services. So the adjustment might be around about 700 something, short of $1 billion. But he would love to get more for 2021, because we're still talking about the 2020. So thank you very much to the team for at least of trying as much as they can to see how we can be able to bring the solutions. Thank you, Chair. Over to the department. It doesn't have to come back to me now.
Sure. Thanks, Minister. HOD.
Thank you very much, Chairperson, and thank you to the members, and thank you to the Minister for the introduction. I think the schedule is very clear. It's put in front of you. You'll see that the reduction overall to the department was 759 million. And it's mainly made out of a reduction of compensation of employees, which comes out of equitable share because of the National Treasury reduction of compensation of employees based on a national position on not increasing the salaries of public servants. So that's the big bulk. There's also an under recovery of revenue that we ourselves, because of COVID, could not actually raise, and mainly because certain very important surgical procedures for which we would normally have sent bills to people is something that we could not recover during the COVID period. So those are the two big amounts. There are smaller amounts in terms of other reductions and then also additions. And that is mainly linked to some amounts that's been taken out of the conditional grant. And that was linked to reprioritization at the national level of conditional grants. And there's been some reductions for us from that perspective. But then we've also added some addition in terms of the national conditional grants, specifically for community health workers and for enrolled nurses in relation to that. And then just lastly, what the provincial government has decided to do is not to take the money that we have been given for COVID, that remains in our budget. So it's really about managing what we have for the rest of this financial year and then preparing for going into the new financial year. I would just like to say, Chairperson, and that's what is in the Treasury letter to us, and you can see it to all of you. There is just want to give credit to the phenomenal work that the people in the finance section has been doing in our department. While everybody has been running around with COVID and really, really abnormal work, they've kept the machinery of our department going. I really would like to commend Mr. K, all the finance colleagues that's on this line. They've done phenomenal work in terms of being able for us still to be a very stable organization that prides itself on due diligence. And as the external agencies came in and looked with a fine-tooth comb for potential corruption, not a single misdeed was found around supply chain for the process of PPE. So I really would take my hat off and commend the staff of the department. Thank you, Chairperson.
Thank you very much, HOD, and that is indeed commendable. We share your sentiments. Colleagues, members, you will find the detail of the submission as was provided to us on pages 101 to 132 and the annexures enclosed to that on pages 133 to 165. Members, I would ask you, as in the beginning, that we kindly stick to the business of the day. Members will be afforded the opportunity with regards to general questions and further written detail in order to do so in terms of their parliamentary privileges. Members, I will then now ask you to raise your hands, those of you that have questions with regards to the pages mentioned, and then immediately as I acknowledge you to please refer to the page which your question is based on, and then I will refer to the Minister or the department to answer, please. I see Member Windvogel. I see Member Allen. Is there another hand, members? I see Member Barnes. In that order, Member Windvogel, please proceed.
Chair, can you hear me?
I can hear you, member. Please proceed. Thank you.
Yeah, mine is on. Thank you, Chair. Thank you, Chair. Mine is on page 101. And
It's
then
breaking.
amount to be
We can't hear.
appropriate.
Member Van
We can't
Vogel.
hear.
Member Van Vogel.
My,
Your
my
sound,
question is on, yes, ma'am.
your sound was extremely distorted. Do you mind starting over, please?
Okay, my question is on page 101, Chair. Can you hear me now? Am I audible?
Yes, we can hear you, member.
Yeah, mine is on page 101. What I wanted, Chair, that we will not support the budget that is decreased by over 700 million. In the 2019 adjustment estimates, an allocation to increase stipends of community healthcare workers was provided for. And we see on Thursday, they protested in front of the legislature, demanding better working conditions. Why is there no allocation for this? What is happening? Can you hear me, Chair?
I heard you referring to page 101. We are not
Yes.
yet where we will then either record your minority view or not. Can you kindly just refer to your sentiments in conjunction with page 101, please? I will afford you an opportunity to just sort out your connectivity, Member Van Vogel. I will come back to you. Member Allen, please proceed.
Thank you so much, Chairperson. I will just stick to one question at this time, and that's on 101. But I do feel it's somewhat of a general question with regard to the decrease. But firstly, I would want to commend the Minister as well as the HOD. During COVID, we've heard of various stakeholders that has been giving glowing sentiments regarding the work of the Department of Health. But in terms of the decrease and the mention that we are potentially not out of the woods as yet, and then linking that directly to staff and the morale that staff might be having at this time, is there any sentiment from the department that we are sufficiently okay in order to deal with any second wave if that do happen, considering the huge decrease? Thank you so much.
Thank you, Member Allen. Member Barnes.
Thank you, Chair. Quickly, my question is on page 112, Program 2, the District Health Services. The Department of Transport and Public Works, the shifted vote. How much did the department spend on the CTICC Field Hospital, and whether there has been consultations made with regard to the closure of the hospital? Is the public care ready and prepared for the COVID-19 resurgence? My second question will be on page 113, Chair, the realignment of the compensation of employees, the COE. I would just want to know that why would we reduce the budget close to 600 million during the pandemic? How will this add to the crisis of the shortage of staff within the province? And what are the reasons for this? And what are the details of the post that will be affected? Thank you, Chair.
Thank you, Member Barnes. Member Van Vogel. Member Van Vogel, can you hear?
Sorry, Chair, Member Van Vogel is still off. She just wrote me a message. She's struggling to get in. Apologies for that one.
Okay, can I please ask ITC to be of assistance to Member Van Vogel? Then I will afford now either the Minister or the Department to kindly respond to the two questions. Thank you.
Chair, I'll just respond to just a few or one or generally, and then the HOD and the team can add. Regarding the wage bill, the compensation of employees, the members will recall that the National Finance Minister, who indicated a pause on the 3-year agreement that was between them and the unions in regards to the salaries, and therefore it meaning that this has to be absorbed by the departments in regard to pausing any of the new appointments, and also even the for reducing, even for, I mean, also in regard to also for the increase in terms of the wages. So it is a national induced problem in regard to that, because at the end they will be reducing our equitable share as well. Also taking notes in terms of the grants that have been reduced. One of those is the training grant, and also the HIV grant, although they've just boosted now specifically for the COVID. So in order to bail the SAA. So that is the reason that we are sitting in this problem where we need more staff, but now we have to reduce staff. In terms of the readiness, with the CTICC at the time when it started, we're still busy with the other field hospital that are localized. If you recall, Bracken Gate is still going on. I think it's until the end of Jan in terms of the lease. The Sonstral in the Cape Winelands, the Harrico May in the George, and also we have got additional beds for the field hospitals in other local other hospitals from the Vredendal, and you recall even the wards that were donated also by the gift of the givers. So in terms of readiness, is there. However, at the time of the CTICC, we have to contract workers from the GPs, from the nurses, and so forth. Some outside the province, which now when we decommission it, some of them were absorbed in other hospitals like George, where I was, and even as far as Maritzburg and Nelsport, where I've seen some of them, they were from here, this side. But the point is, now that there's a resurgence, they have to explore what other ways in order to get additional of the contract staff, but it will never be the same as it was, especially now that we have to freeze some of the posts because of saving SAA. Yeah, HOD, they can do the others.
Thank you, Chairperson. So I think the Minister has covered the broader issue about the decrease in the budget. Specifically, as we said, there's two big factors for the decrease, and that is money has been taken out from national treasury, out of every budget for all government departments across the country, based on not paying money for the wage agreement beyond 2018. So the 600 million that's taken out of our budget is taken out of every other government department's budget across the whole country. The impact that has, you're right, we already started seeing emails of staff on the ground that we are now ironically asking to double up again for COVID. And there's already a budget decrease discussion, which demotivates people while we're trying to motivate people that's already tired of actually taking on a significant resurgence of cases. The issue specifically to CTICC on page 112 is 52 million that we have, that the Department of Transport and Public Works has incurred on behalf of our department in terms of the contract work to prepare CTICC. So the 52,207,000. And this is work that Public Works did. They incurred the cost. We are transferring that money towards them in terms of that. So the second part of that question is, we have decommissioned CTICC because at the height of what we needed, we had 860 beds. At the height, we used just short of 400 beds. And that was at the height of the COVID the first time around. At that time, the Bracken Gate came online and saw very few patients at the time. So we maintained Bracken Gate. So part of this money, the 52 million, is also to continue the lease costs for continue keeping Bracken Gate going. We can scale up Bracken Gate to 338 beds, And that's the process that we're doing now. And then Freesia Ward, which is on the Lendige premises, through a renovation with a donation from Gift of the Givers, has another 60 beds. So if you add that up, it comes to about 400 beds. And we believe that that is the capacity that we can scale up in dealing with the increase in cases for COVID as we speak. In terms of the general staffing question that Member Barnes has asked, if I understood her correctly, the issue about staffing is that there's an assumption made that the National Treasury that has taken this 600 million out of our budget, there's an assumption that a court case will be won, which is next week in December, that the unions are challenging the court case, that we are allowed not to honor the agreement and then take that increases away from public servants. So depending on the outcome of the court case, it's going to have a massive impact in terms of whether that money then is gone, but we still have to pay people increases. Then it puts our department and every other department in the country in a very, very difficult situation, because that means we're going to have to then lose staff to be able to cope with the situation. Thank you, Chairperson.
Thank you very much, Minister. Thank you very much, HOD. Members Barnes and Allen, do I assume your hands are still up from the previous round?
Chair?
Minister?
No. Yes,
I
Chair.
think the other part of a member Van Vogel, I did hear about community health workers. Although she might not be in now, I think I hear the other part where she was raising an issue related that that the mere fact that they are still protesting, so therefore the issue of reducing the there she is. Okay, she's here. I'll wait for
I just
yeah.
saw her coming on. Thank you, Minister. Member Van Vogel. Member Van Vogel, you may proceed.
Okay. Thank me to ask questions because I'm not sure for how long will I be online. Can you hear me, Chief? Thank you so much.
We can hear you.
Chair,
Not
I think
clear, but we can
my
hear you.
question on the healthcare workers, we saw on Thursday they protested in front of the legislature, demanding better working conditions. Why is there no allocations for this? Why is there no allocation for this? And how is the department addressing the concerns raised? Am I clear, Chair?
You are clear. Thank you, member. Is that the only question?
Then I'm not sure if it was us or because I'm out 1 second in and 1 second out, Chair. Then I'm not sure if I'm even on the right path if it comes to your numbers. But on page 104, sub-program 1.2 management, I want to know, does the department have a budget to pay legal fees? And when it's been fined for these things like these, is there a budget for that? And so, if so, how much is budgeted for such expenses? And is the department currently facing any legal challenges where it could be expected to pay fees? That's all. Thanks, Chair.
Thank you very much, Member Van Vogel. We were able to hear you quite clearly. I hope that you will be able to follow the response as well. You may lower your hand now, Member Van Vogel. Minister, HOD, you may proceed.
Can I continue with the CHWs?
Please continue. Thanks, Minister.
Yes,
please.
I think, yes, Chair. I think it's crucial for us to understand even the history. I'm not going there, Chair. I know you don't have much time, but in regard to how community health workers ended up being part of the health system in South Africa. But to cut the story short, in 2018, in regarding to the bargaining council chambers with the unions and the national departments, one of the resolution 1, was about to increase the stipend, and also various options in regard to how to go forward when it comes to the community health workers. of which is for us, and also increasing the stipend. Also, it meant that also to increase the hours. Previously, for us, they used to work a half a day, then earning at the time, I think 2,800 and something. And then when now it was about now there must be a general money stipend for the whole of those. It meant now that they have to work additional hours. I think it was 40 hours, and then to have that 3,500, which was part of their agreement with their unions. It's part of the bargaining. So last week, for example, the meeting we have with the National Health Council, where it says now we cannot keep on treating health workers as a stepchild of a system, because with other categories, you'll find that there are grants that are related to that. There's never been any grants for community health workers, yet they've been there even during the time, some of them being HIV counselors at the time of the HIV/AIDS. So the issue that there's no standardized even a definition of a community health worker in regard to, as I'm saying, that the others were through the NGOs as HIV counselors, while others, ngonompilo, the ones who do go to door. So there hasn't been any kind of a definition across. So that's why now they came up with different approaches, which is one related to the implementation of the resolution, one related to the bargaining council, two, NGOs employ community health workers, which is the current model the Western Cape is applying. And then the one is a health system approach through a NHI contracting framework, which is where now we can buy services later on when we are using the NHI once it's adopted. And the other one is about the ministerial determination. The Minister of Labour has to determine. And then the last one is about the transfer. So the favorable one that could be applicable, take note that the sector, health sector as a whole, has been knocked down in terms of regarding to the finance. You'll find that now the long-term solution, it will be the one that they will be contracted to the NHI, which is we don't have yet, the NHI. And the short-term one is what is recommended. It's when the Minister of Labour have to treat them the way they do the model for the EPWPs. Now, Chair, my point is the whole of the community health workers is part of the HR of the health system that needs a determination at the national level, starting with a common definition and where we go. So currently, our model of the community health workers as part of strengthening primary health care, community-oriented primary care, is the way to go. So in terms of the PPEs which we provide, in terms of the condition of service which we provide, and that's why we find that they are all, the supervisors are professional nurses and they are linked to a primary care facility. So that's where things are. In terms of the provision, in terms of the budget, unfortunately, it has to be like, as you see there in the COEs, where we have to have a cuts throughout. This also will be applicable to them, but for them, fortunately, because of the COVID and HIV, there's actually more budget that is also to be placed to them, even for the 2021, because they still have to do community screening and testing. Thank you, Chair. HOD.
Thank you, Minister. HOD.
Thank you very much, Chairperson. So let me just respond to the medical legal claims, the question from Member Windvogel. And the issue there is that we have a lot of cases where lawyers on behalf of people that have suffered an injury in the healthcare practice take us to court for claims for damages because of injuries. And most of these are for birth injuries. We have a long established practice in this province that we have engaged, we've worked with the courts, we've got agreements for trusts, for repayment. So our payment for these claims, in response to these claims, is much lower than in other provinces. And we have a medical legal unit that works with it. A concerning aspect is that this medical legal claims across the country is escalating significantly. What we have to do is we make a budget available, but at any given time, we track and see what is our payments against it, and then we need to adjust it upwards. So at this point in time, our claim so far for this year exceeds what we are having projected or have put forward in our budget. And therefore, even into next year, we need to look very carefully at the amounts of money we make available. But we can assure the members, our team goes into legal, into the process and really work with every single case through our lawyers to make sure that we pay the minimum in terms of claims, and that it is then done via a innovative mechanism such as trusts, and if the person dies, that the money of the trust reverts back. So that is the mechanism, and it's become a model for the country of what we've got. Just to add to what Minister Mbombo was saying about community health workers, I did make, and you can see it somewhere, it's called the presidential allocation under the HIV grant for additional money. That is actually additional money in this year for community health workers. And it is for additional community health workers, not for increasing the salaries. It's for additional community health workers and then for additional nurse supervisors, enrolled nurses. That is the amount that has come out of the HIV conditional grant. Although the entire conditional grant is brought down, and a certain amount was put back specifically for that purpose. But everything else Minister Mbombo has said in relation to the national process is what the status is around community health workers. Thank you, Chairperson.
Thank you very much, HOD. Members, I will then ask you to, if you have further questions pertaining to kindly put that in writing, and also in terms of further recommendations and resolutions that will become part of our minutes of this meeting, kindly forward to Wasim Matthews by Monday, please. Can the procedural officer kindly access? Do we have any members of the public that would like to make an input at this stage?
Chairperson, there's been no indication of members of the public wanting to submit any comments.
Thank you very much. Members, can we agree then to conclude the question and answer session at this point?
Yes, Chairperson.
Thank you very much, Member Botha. At this point then, I wish to thank Minister Mbombo, HOD Kluter, all departmental officials and members of the public that might have been in. Thank you very much for your time. Thank you very much for your effort. And thank you very much for the sterling work that you do in the Western Cape under very difficult conditions and circumstances. We do appreciate you being here this morning and indulging the Standing Committee on Health. Thank you so much. And I will now excuse you. I will kindly request members to kindly stay behind in order for us to consider our report. Thank you very much.
Thank you, Forsyther and members. Thank you, Dr. Kluter and your team. Thank you. Bye.
Bye-bye. Members, the Standing Committee on Health, having deliberated on the subject of Vote 6 Health, in the schedule to the Western Cape Second Adjustment Appropriation Bill 2020-21 financial year, Bill 7 of 2020, referred to this committee in terms of Standing Rule 188. Reports, can you kindly then indicate your support or your minority view in terms of Rule 190, members?
Chairperson.
I recognize Member Allen, Member Botha, and Member Windvogel in that order.
Thank you, Chairperson. I move that we support the vote. Thank you.
Member Botha.
I second that proposal.
Thank you very much. Member Windvogel.
Chair, I call on Rule 90 of the standing rules. Needs to be reflected in the minutes.
Thank you very much, Member Windvogel. Then we, the registering of the minority view of the African National Congress in terms of Rule 19 is thus recorded. Members, Mr. Matthews, I believe we still have a few minutes. Do you mind just flighting that report for us to just adopt as well? The Standing Committee on Health. Are that in order with you, members?
In order, Chair.
Thank you, Member Botha. Any other business that we need to attend to, Mr. Matthews?
No, Chairperson. Everything's in order. We'll just need to remind members what you said earlier about the recommendations and the resolutions. They can send it to me by Monday because I know members are in back-to-back meetings today, so Monday should be fine. Thank you.
Much appreciated, Mr. Matthews, and thank you so kindly for your support and all our other WCPP members as well. Members, that concludes our meeting today. Thank you very much for your effort and thank you so much for your time and thank you so much for deliberating on this matter. I thank you so much and I wish you a blessed day and a blessed weekend ahead. That concludes our meeting. Thank you, members.